This whole historical arc, it just shows this accelerating curve of capability, moving from simple rules to sisters that learn and adapt on a truly grand scale.
Okay, but here's where it gets really interesting for our topic today, because we're not just talking about abstract AI theory anymore, are we? We're now seeing these just astonishing breakthroughs in directly interacting with the human brain itself. This isn't some far-off speculation. It's becoming a present-day reality, especially with these advances in brain-computer interfaces, or BCIs.
That's exactly right. The advancements in BCIs are truly pushing the boundaries of what we thought was possible, moving way beyond theoretical discussions into tangible real-world applications. Neuralink, for instance, Elon Musk's company, is probably the most prominent and often discussed player in this space right now. And their progress has been genuinely remarkable, even with some initial hurdles. On January 29, 2024, they hit a really significant milestone with their first human implant. A patient named Nolan Arbaugh, who was paralyzed, received their N1 Link device. And what's truly incredible here is that this implant enabled him to control a computer cursor, compose text, using only his neural impulses, basically using his thoughts. He actually demonstrated this live, playing online chess, managing his computer completely hands-free, and critically, while there were some early reports about electrode threads retracting slightly.
I remember hearing about that.
Yeah, but no adverse biological effects were reported from that initial procedure, which is just a massive step forward for the safety and, the viability of these kinds of implants. It's the fundamental proof of concept, really, a direct data stream from the human mind, proving the brain can speak digitally.
That is just astounding to think that thoughts alone can directly manipulate a computer screen. I mean, it sounds like something out of a sci-fi movie from just a few years back.
Hmm.
And you mentioned that challenge with the electrodes. That got sorted out.
It truly is amazing. Yes, the journey wasn't entirely smooth sailing engineering-wise at first. In May 2024, there was that report that, yeah, about 85% of the electrode threads had retracted somewhat early on post-surgery, and that led to a temporary dip in performance. But the good news is that stability and functionality returned as the brain tissue settled around the implant. And Neuralink engineers, they were able to implement some clever software adjustments to compensate for that retraction, which really demonstrates their capacity to adapt and refine the tech in real time, learning from that very first patient's experience.
And they didn't stop there, did they? I heard they moved pretty quickly to a second patient, presumably applying those lessons learned.
They did, yeah. On August 4th, 2024, a second person received the Neuralink implant. And this time, the device showed improved performance right off the bat. Reports mention 300 to 400 electrodes actively functioning, and notably, no retraction issues were reported this time, which suggests those adjustments they made were successful. It's a clear indication of really rapid iteration and improvement, a testament really to the fast-paced development cycles in this field.
And the practical applications they're looking at for these devices, they're really compelling, especially for people with significant disabilities. It's way beyond just moving a cursor now.
Absolutely. There was a particularly poignant and impactful use case that emerged in May 2025. It involved Brad Smith, a nonverbal ALS patient. Through his Neuralink implant, using just subtle jaw and tongue signals, he was able to type, edit videos, and even synthesize speech with the chip's help. Just imagine the profound impact that has on someone who's lost the ability to communicate and interact with the world. This goes so far beyond simple cursor control. It demonstrates this profound restoration of communication, of agency, literally giving someone their voice back and enabling them to engage in creative things they might have thought were totally lost forever.
Wow. It's hard to overstate the potential for that kind of technology to genuinely transform lives.
Yeah.
And it sounds like this isn't just confined to a few isolated cases in the U.S. They're actively expanding trials globally now.